And I think there should be a state moratorium on any expanded benefits. No more mandates and no more increased generous benefits for the public employee or for the Medicaid payment until we have our hands around the current cost of these programs. Now, I will suggest that government can and should focus on the uninsured population. We don't think that employers should be expected to provide all of the revenue to cover the cost of their own employees and then everybody else as well. Government needs to make it easier for the insurance industry to offer those affordable, mandate-light type insurance offerings where you and I and individuals and the uninsured in particular could be more of a smorgasbord buyer of health insurance than the mandated limited offerings that are currently available. Government can and should help those who are least able to help themselves. And to a certain extent, we already do that, but I will acknowledge that we probably need to go beyond those who are currently provided for and talk about people who are in catastrophic situations and offer benefits for that. And I think we should also look upon expanded government programs for those people who have pre-existing conditions and would not be insurable in the private sector. Those are legitimate roles for our government to play and should be engaged in. I do believe that means testing is reasonable. The S-chip debate that we've just heard about over these last few weeks in Washington and just yesterday, what that comes down to is means testing. Are we willing to provide government health care for people whose incomes are $60,000 a year or $80,000 a year or $100,000 a year? It doesn't matter. I would suggest to you that most all of us recognize that the low income deserve government assistance. The question before us is a philosophical question about when does low income become middle class and when does middle class become everybody other than the top 2 or 5% of the wealthy population in our nation. That is the test, a means test, which says at what point government stops providing. And as I pointed out earlier, there are many folks who want to keep pressing the envelope about what's the legitimate role for government. It is reasonable to consider, I think, tax credits as an incentive for small employers to provide health care. I think there are small employers in particular who do not provide health care for their employees merely because of the cost of the market. And I believe that government should consider offering some kind of tax credit if it is in our interest to maintain a private sector health insurance program, and if it is in our interest to reduce the number of people who are uninsured, then I think it is legitimate for our government to consider offering tax credit type programs for small employers to incent them to provide that health insurance, which I believe many and most of them would in fact offer if they felt there was an affordable solution to them. And then lastly, and I emphasize again, our government should be promoting healthy lifestyle changes. Our government should, as a matter of course, be engaged in an educational system, just as we educate consistently about the evils of smoking. We should be consistently educating our population about the need for changing our lifestyles to a more quality lifestyle, and I think this should begin in the school systems. Now lastly, let me just talk about the future. And that is, ultimately, this is going to play out on the national level. And I don't know that we know the answer to this. I believe that there is a critical debate underway. I would say that those individual states who have tried to take on universal health care or significant health care change so far have all failed, or the jury is out. Maine tried it. It practically bankrupted the state of Maine. Tennessee tried it. It practically bankrupted the state of Tennessee. Kentucky tried it. And when it was done, there were only one or two insurance companies even offering health care policies in the state of Kentucky. Now, I think the jury is still out on Massachusetts, and the jury is still out on California. It is true that in this nation, oftentimes the states are the proving grounds for changing policies. But I am convinced at this particular point in time, no one state should go it alone to try to resolve these issues. And those states who do, I think, risk two fundamental economic issues, one of which is the cost of providing the service is something that cannot afford. That's what happened in Tennessee, that's what happened in Maine, and quite frankly, I think that that would very, very well happen here. Cannot afford in part because of the size and the scale of the program, but also I believe it becomes a magnet for other people to come to that state who may not have already been in that state to say, I can move to Illinois or I can move to Tennessee and get health care that I cannot get where I am now. Why do I want to stay where I am? This is a very mobile nation. The other economic implication is, again, back to cost. When a state, as in the case of Illinois, proposes to impose billions of dollars of additional cost upon the employers in their state, vis-a-vis employers in other states, there is an economic consequence to that, an imbalance that will play out. Maybe not today, maybe not tomorrow, but if it occurs, I believe there are consequences that will play out. So I think any state who goes down this path risks both of those possible options. I do believe that there is a fundamental conflict over big government and private sector decision-making. This nation fundamentally has long believed that the private sector is the right place to be, that the private sector are the real job creators in this nation, that we have a fundamental distrust of our government. We have not a lot of confidence that our government can do anything very well except maybe put a man on the moon. So there is a discount or a distrust or a gap between public sentiment and government, big government solutions, high-cost big government solutions. But having said that, we also have industry leaders and employers, most specifically those who are multinational employers, who may have a slightly different perspective, and that is when I'm competing globally and I have high costs in the United States, because in the United States, my auto workers are imposing a huge cost on my product, an automobile, that my competitors do not carry because they are in government-funded healthcare systems. Well, then the economics may begin to change. And I think that's part of what we've seen most recently in the UAW settlement that we've all heard so much about. So therefore, there is not a uniform consensus among the private sector employer community about the long-term outcome. There are those who believe that they're, number one, tired of having to shop. Number two, they're tired of the high cost. Number three, they're concerned about the competitive environment. And number four, it's inevitable that government's going to take this over because government takes over everything to try to give us a better solution. So why not just fold our tent today and acknowledge that we're going to have government-provided universal health care, single payer in the United States, just as we have in other parts of the world. Now, I would say that's not universally held, but I would say that helps to illustrate the conflict that goes on within the private sector on these matters.